Hello and welcome to this special Foster Care Institute training webinar, Birth Children and Adoptive Foster Children Living Together in the Same Family. I'm your host, Dr. John DeGarmo, founder and director of the Foster Care Institute, an author, a speaker, trainer, a foster parent myself. And I want to say a special thank you. Thank you to the great foster care agency, MSPCC, their wonderful staff, and of course, their amazing foster parents. I'm so glad that you're part of this special webinar. Through the years, my wife and I have had over 60 plus children join our home as foster parents. And if you've read some of my books, you know my story that when I say that there's no label in our house, there's no biological or adoptive or foster child. They're all our children, and we love each one unconditionally. We love each one as family. Yet there are times, though, when there can be some stress when you're caring for children in foster care in your home, stress that may bring challenges to your own children. During this webinar, we're going to increase your awareness of what the trauma and grief and how it impacts lives of children in care, including your own children, and gain an understanding of how to develop and implement strategies designed to aid all of the children with their feelings during a stressful time. To be sure, anytime a child is placed into a foster care environment, it is a time of anticipation, many times for the foster parents. The time of anxiety, time of stress. Yeah, for foster parents and the foster families, it can be a time of anticipation. Will the child fit into our home? How will this child correspond with our own children? Will it be a smoother transition than others? Will there be an immediate bonding? What is this child like? What are their interests and hobbies? So many questions that foster parents have. Yet we also know that there's a time of great stress and anxiety for the children being placed into our homes. I want you to imagine a child taken from their moms and their fathers, their mommies and daddies, sometimes their siblings, their family, taken from their stuffed animals, their toys, their pets, their bedroom, their kitchen, their house, their home, their aunts and uncles, their cousins, their playmates, their neighbors, taken from their school, their teachers, their classmates, taken from everything that they know, all that is familiar with them, many times without any explanation whatsoever, and placed into a strange home, perhaps your home or my home, with strangers, people like yourself and myself. That for this child, it is a time of tremendous uncertainty. They have questions like this: why am I here? Who are these people? How long will I be here for? Did I do something wrong? Does my mommy and daddy not love me anymore? Is it my fault that I'm here? And for some of these youth placed in foster care, it may be a time of guilt. They may believe that they are at fault. They may believe that they are the reason why they've been removed from their home. They may think they did something wrong. And for some children, being placed into a foster care environment, they may be unable to express themselves. They may be unable to express the anxiety they're feeling. I think back to a 4-year-old child that was placed in my home years ago. The child had cigarette burns on his roof of his mouth, his tongue, his genitals, all by his mother, over and over and over again. And you can imagine this child was filled with anxiety from the trauma that he experienced. And for this little 4-year-old boy, there was no emotions he expressed: no shock, no grief, no anger, no surprise, no eagerness, no anxiety, no joy, no sorrow, no anger, no frustration, nothing. Only, just only time he showed emotion was one time. I expressed it in my book, Fostering a Loved One Foster Parents Journey. But for this young boy, he was unable to express the many, many emotions that were swirling inside of him, emotions that perhaps he was suppressing, or maybe emotions he did not have the words for. Very challenging time for all in our house during that time. As we've seen here at the Foster Care Institute, and perhaps you've seen in other training webinars and studies, Children in foster care often suffer from post traumatic stress disorder, PTSD. It's an anxiety that occurs after someone has experienced or witnessed an extreme traumatic event. For those who suffer from post traumatic stress disorder, the individual often feels overwhelmed. They're overwhelmed with fear, overwhelmed with terror, or maybe an overwhelming feeling of helplessness. But do you know this? Children in foster care are twice as likely to suffer from PTSD than our war veterans. Now, to be sure, we talk a lot about our war veterans, those who have served our nation violently. We hear a lot about them having PTSD, and rightfully so. But we do not hear much about the children who have suffered from PTSD, children who have experienced such trauma, children who are filled with anxiety. Indeed, roughly 21% of youth who have aged out of foster care or alumni from the foster care system suffer from PTSD. Now, children are placed in foster care for a number of reasons. Perhaps prolonged separation from a family member, maybe the death of a family member, various forms of abuse, witness of abuse to others. Indeed, 5 million children in the United States experience or witness domestic violence or domestic abuse within their own home. Some to come to a foster care system after being homeless. Many experience drugs or alcohol in their family. Many are neglected or abandoned. Some are placed in foster care perhaps because one of their family members is incarcerated. All of these, to be sure, are traumatic experiences for the child. So, whatever the reason the child is placed into foster care, they have suffered some type of trauma and are most likely experiencing some sort of anxiety. And then they come to live with us. And yes, it is a time of anxiety for that child. As I mentioned earlier, they're asking questions like, why am I here? When do I go home? When do I see my mommy and daddy next? Is it my fault? So they are filled with anxiety. They're filled with questions. They are afraid. They're concerned. They're confused. And when that child is placed into her home, that child filled with confusion, that child filled with emotions they do not understand, a child filled with so many questions, maybe even anger issues, well, to be sure, our family will change. The family dynamics in our house will change. When at any time a child is placed into a foster care environment, anytime a child from foster care is placed into your home, make no mistake, your family dynamics will change in some way. Perhaps the oldest child is no longer the oldest, or maybe the youngest child is no longer the youngest. Maybe the middle child is no longer the middle child. Maybe the only child now has some siblings. Maybe a family with no girls suddenly has a girl placed in their home, or a boy placed in their home where there's been no boys before. The dynamics of the family will change in some way. And sometimes there is a challenge of adjusting to these new family positions, if you will. And as a result, as you can imagine, sometimes behavioral problems may occur. Behavioral problems not only within the child from foster care in the home, but sometimes maybe behavioral problems within your own family and with your own biological children. Sometimes some of the challenges that children from foster care bring to our home, maybe the transition from the biological home is one that's filled with trauma from their home to your home. Everything the child has known has suddenly been lost. They have lost everything, many times without warning. All that they've known, all they're familiar with, has been completely taken away from them. Their everyday routine, their lifestyle, however disruptive or abusive or neglectful that lifestyle may have been, when they're placed into your home is not their norm. Yes, you can provide stability and you can provide safety and consistency and regular meals and a nurturing and compassionate environment. But at the end of the day, your home is not their home. Your rules are not their rules. Your norms are not their norms. Their everyday routine and lifestyle has been completely disrupted. And this can cause additional anxiety for the child. Now, as we discussed here in one of our training webinars with MSPCC, and I hope you were part of it, we talked about marriage and foster parenting. There are many challenges that a child in foster care can bring to a home. Anytime there's a difficult foster care placement, it might be a challenge for the marriage, to be sure. Being a foster parent can be difficult financially because we give all these children all they need, such as marching band or football or dance lessons, big birthdays and Christmases, whatever it might be. And many times that comes out of our own pocket. And that's okay. That's okay. Being a foster parent can sometimes be challenging to our health. Sometimes we're filled with burnout or feelings of grief and loss, and other life issues such as school for our own children or work or whatever it might be. It is a challenging and very, very unique lifestyle being a foster parent. And let me stress that word one more time. Being a foster parent is a unique lifestyle that no one will truly ever understand unless they live that lifestyle themselves. And there's a challenge of working with birth parents as well. Now, let's be clear here. Many times, birth parents and biological family members are also affected by feelings of grief and loss as well. And we address that in another webinar here. But going on, when a child is placed in your home, many times it's a time of new rivalry. Now, if you have more than one child in your house and they're close in age, you know that there's sibling rivalry. Sometimes they do not wish to share their toys. When a child in foster care is placed in a home, there's going to be a new rivalry. It's a time to share everything. They're now sharing some of their precious and beloved toys, sharing books, sharing the TV together, sharing games together, and perhaps most importantly, the biological child is now sharing their parents, their mothers and fathers, you, with their foster sibling. And that can be a difficult time for your own child. Your own children may have feelings of jealousy. They may have fears or concerns that their new brother and sister from foster care will get all of the attention. Now, as a foster parent to 60 plus children, I can assure you I understand what it's like caring for a child filled with anxiety in your home, whether it's anger disorders or sleep disorders or eating disorders or reactive attachment disorders or whatever it may be. When a child is placed into your home, and many times they just crave your attention because they need it. Well, your own children feel they may get left out. They may feel that their brother and sisters from foster care is getting all the attention and getting none from you. This is a difficult time for your biological children. So as a result, your own children may test you. You see, their sibling from foster care is now coming into home, and sometimes they're not having the same consequences to the rules that they break that your own children may do. Now, if you're like me, and most likely you have these same things, you have rules and consequences in your home. And your children understand these consequences. Yes, when they break a rule, they choose to break a rule, there's going to be a consequence as a result. Yet their children from foster care may not have those same consequences. So your children are going to be looking to see if there's consistency, a level of consistency between them breaking a rule and their foster sibling breaking a rule. They're going to want to see if they can get away with things now that there's a time of upheaval, if you will, in your own home. Sometimes the foster siblings just simply do not get along. I've seen it in my own home. Many times the children have blended so very well, and it has been a blessing to see that. But there have been times, though, when our own children simply do not get along with their foster sibling or the placement in your home. As we've seen here, that transition from a biological one to your home is a time of challenging, and their everyday routine is and lifestyle is completely disrupted, and your children can be affected by that. The rules, the sharing, the lack of consequences, the lack of bonding can be a difficult time. When a child is placed in your home, many times they do not understand why they're placed in your home. They're filled with feelings of confusion. They may blame themselves. They may feel they're no longer loved. They may feel abandoned. As a result, they may act out or they may withdraw. And this affects your own children. When you adopt a child, maybe perhaps in the foster care system, there are other issues as well. I want to be clear here. Please note that 65% of adoptive parents now experience something known as post adoption depression syndrome. We have a whole webinar here at the Foster Care Institute about it. And if you're an adoptive parent, I would encourage you to learn about post adoption depression syndrome. Your own children can be affected by adoption as well. Now, when a child is adopted, many times they may have a sense of identity. They may wonder why they were given up, so to speak, by their birth parents. They may wonder if there are other family members somewhere out there for them. Sometimes they may feel guilty for being adopted. They may feel guilty that they felt a sense of betrayal to their own birth parents or biological family members. And also remember, adoption is a time of loss. So when you adopt a child, remember they may be experiencing this, and as a result, your own children will somehow be affected by it. So hopefully you're getting a sense here that when a child is placed into your home from foster care, or maybe a child has been adopted, your own children are somehow affected by how the child from foster care or the adopted child is feeling. As we said there, post-adoption depression is indeed normal. And again, we go into that in another session here. So let's continue here. Sometimes as we mentioned earlier, sometimes a child being placed in foster care may be a difficult placement into your own family. Just may not be the right fit. Your own marriage may suffer, your finances may suffer, your health may suffer, you may be experiencing burnout or grief, and your own children recognize and see all of this happening. Your own children can see when your marriage is stressed. Your own children can see when there's a stress in finances. Your own children can see and feel when you are experiencing challenges with your own health, or that you're burned out, or you might be suffering from grief and loss after a placement has been removed from your home. Your own children are affected by what you go through as well. So you can see it can be a very difficult time for your own child. So how do we do it? How do we bring a family, a new family, together? Well, to begin with, we need to be prepared. We need to be prepared for the emotional stress, the emotional anxieties for your children in your home. We need to be ready for it. To begin with, we can research online and in books and in webinars and in podcasts how to meet these feelings. We need to sit down and listen to the concerns of our own children. When a child is placed into your home, we need to sit down with the child and listen to any concerns they may have. Or when a child is placed in your home, sit down with your children periodically and ask them how they're doing. Listen to any concerns they may voice. Now be patient. This may take some time for them to share with how they're feeling. Always reassure your own children that they come first. Always reassure your own children that you will always be there for them. Always reassure your own children that you will forever love them, and nobody is going to get in the way of that. So make sure you give attention to your own family members as well as your spouse. When a child is placed into your home, sit down with your family and talk about how The family dynamics may change in your home. How the youngest is no longer the youngest, or the oldest will no longer be the oldest, or the only child will no longer be an only child. Talk about those changes beforehand and talk about how they might feel about that. How do you feel about no longer being the oldest child? How do you feel about no longer being the baby of the family? What concerns do you have about that? How are you worried about that? Have that important family discussion. When a child is placed into your home, this is a great opportunity for you and your children to prepare together. To prepare together. Go shopping with your own children and buy some new gifts for their new family member. Find out the age, of course, for the child beforehand, and maybe buy some stuffed animals for the new child, or maybe some diapers and baby bottles, or maybe for an older boy or girl, a football or basketball or baseball, or maybe some board games. But go and buy some new gifts for their new foster sibling. Encourage your own children to help arrange the new bedroom, make it a brand new bedroom for their new foster sibling. Maybe even make a welcome to our family sign. But help clean up and wash the sheets and fluff the pillows and make the room so welcoming, but include your children in that. When you have a foster placement in your home, it's important that you take time alone, you as a parent, one on one with your birth children. Now, I know how difficult this can be due to time constraints, but it is important. Give the birth children time alone with their birth parents. One on one, take maybe once a night or once a week, read to your own children. Sit down and read to your own child. Go play with them, throw a frisbee, play basketball, go for a walk, maybe one on one, mommy and maybe mommy and daughter, or daddy and daughter, mommy and son to the movies or ice cream. Or we have in our home something called special time, where one adult and one child will go off once a month, maybe for a couple hours, and have some special time where we do go to a movie, or we do go shopping, or we do go for ice cream, whatever it might be. That's important time together with a biological child and their birth parent while being a foster family. We talked a little bit earlier about sharing. It's okay for the children to keep some things private and separate. If your child has a really special toy, I think back to Linus and his blanket, right? Special blanket. And Linus didn't want to share that blanket with anybody. So it's okay for those children to keep some special things private and separate. They don't have to share everything. No, not everything. This is essential. Have rooms about privacy in bedrooms. It should not be your child and their foster sibling in the same room at the same time with doors closed. Absolutely not. There are rules about privacy. And you know those rules. You know those rules. Use your gut feeling about those rules. Have rules about privacy in bedrooms. An older boy should not be in the bedroom with a younger girl, and vice versa. Or an older child should not be in the bedroom of a younger child, and vice versa. The door should be open at all times. You should know where your children are at all times. And you might have some rules that simply say you're not allowed to go in each other's bedrooms, and that's perfectly fine. In fact, that may be a very good idea. One way you can bring the family together is by having time together. When you want to have that family bonding, that family learning how to attach to their new siblings and new member of their family, well, you do that by spending time together. So find ways that children can play and interact together. Maybe having a movie night once a week at your house where you sit and cook popcorn and spread it out and sit down on a blanket and you watch a movie once a week. Or maybe you go to a sporting event or play sports together. Maybe once a week you have game night, or you continue to work on a puzzle, you go swimming. The list is endless for you to find ways for your entire family to interact together, to play together, to spend time together. When you have a new family member in your home, it's possible to start a new family tradition. We talk a lot about life books here at the Foster Care Institute. Indeed, we have a webinar about it, and we address it in the book, The Foster Parenting Manual. If you're unfamiliar with what a life book is, I encourage you to check out one of our webinars or ask your caseworker about life books. But start a life book with your children. If your children from foster care come to your home and they have different cultural differences, well, include those different cultural differences. If a child has been adopted, and celebrate that gotcha day or that adoption day. Remember, when a child's placed into your home from the foster care system, birthdays and holidays can be a time of sadness. So recognize that. Recognize that while you may be celebrating, the child may not. Remember the children's birth parents in your home and ask about them, and maybe have the child draw some pictures and send them to the children, or maybe have phone calls or whatever it may be. But find time to have family time together. Create some new family traditions. Sunday nights here at the DeGarmo House, it is game night. Tuesday nights is no tech Tuesday in our home. If a child's going to communicate openly with you, you need to model what that communication and listening looks like. You need to know the part of the pun there, but you need to foster those skills in children. So sit down with them and talk to them and listen to what they have to say. If you have a family meeting in your home, the child plays in foster care in your home, you need to make sure you include all the people in the home. If a child from foster care is placed in your home and you have a family meeting without that child, you're telling the child they're not part of the family. So family meetings include everyone in the conversation. Of course, conversations are age appropriate for the child. Each child in your home also needs some alone time with you. That includes the foster children as well. Each child in your home needs some love and affection from you as well. Remember, each child is different, each child is unique, and sometimes the cultures where the children come from make up some of those unique differences in the child. So if they are from a different culture, if you look at my family, my wife is from Australia, and some of our godparents are from Germany and Switzerland. So as you can imagine, we try to incorporate all of that. We try to have some Australian foods and German foods. We try to have some German and Swiss music, and we celebrate Australia customs, and we try to teach our children different languages. So try to include those different uh, cultural differences in your own home if a child is coming to your home that has different cultural beliefs and backgrounds. Become a culturally competent family. Culturally competent families create understanding and awareness of different cultures and beliefs in your home. They help children develop strategies designed to combat racism the family might encounter. Now, we're not going to go into racism here in this webinar, but we do have some here at the Foster Care Institute if you're interested in learning more about that. Culturally competent families understand their own beliefs and their own attitudes when it comes to their own culture. And cultural competent families always are seeking out to learn about other cultures and different ways of life. We love the DeGarmo House to celebrate and include different cultural differences that we think might be that may enhance our family, that may help our family to grow and understand others better. Talk to your children about these differences and similarities. And of course, there are so many different cultural differences. Many times, children come to us with different sets of values. Well, if it's appropriate, include some of those values in your own family, again, if appropriate. Now, when you're caring for a child in foster care in your own home, it's important to remember that sometimes you can't do it by yourself. Sometimes you need help. Sometimes your children need help. Sometimes your family needs help. So it's okay to ask for help. It's okay to go for professional counseling and professional therapy. Indeed, professional therapy and counseling sessions can provide professional insight and help for your family. You might need to have some family counseling sessions. It does not mean your family is crazy or weird or strange. Indeed, when you seek out professional counseling sessions for your family, what you're doing is you are helping your family. You're giving your family skills and professional help. Indeed, you might need some professional help as well, and that's perfectly acceptable and understandable and indeed normal. It is again normal. Think of it this way. At the DeGarmo household, I am not a heating and air conditioning guy. So when our heating and air conditioning break, I'm calling up the professional. When a child in our house has a toothache, I'm going to see a professional. When our car has trouble, we're going to see a professional. Does not mean I'm a failure at heating and air or car mechanics or dentistry. It simply means I have not been trained or do not have the skills in that. So I'm going to be proactive and seek out professional help. There are times that you may need to be proactive and seek out professional help for your own family. And that's okay. Keep this in mind. Anytime a child joins your home, anytime a child from foster care is brought into your family and placed with your family and your own children, this can take some time. It may take some time for trust to develop. It may take time for the child to recognize, I'm not going to be hurt here. It may take some time for the child to recognize, I'm going to be okay. It may take some time for your own children to recognize, hey, I like this kid. It may take time for your family to bond, and that's fine. With that time and with that understanding and with these skills you talked about, welcoming a child into your home, celebrating cultural differences, including some of their beliefs in your home, making new family traditions, spending time with your own child one on one. When you do these skills, it's going to make it easier not only for the child placed in your home, not only for your own children, but for you, your spouse, and the entire family. For much more on this, visit the Foster Care Institute at drjohndegarmofostercare.com. Please follow me on Facebook and Twitter at Dr. John DeGarmo. If you have questions about this webinar or want to hear more about it, simply email me at drjohndegarmo@gmail.com. And if you're not a member of the Foster Care Institute, I encourage you to consider joining, where you'll get unlimited access for 12 months to over 65 hours of online training webinars, printable certificates, CEUs, 14 free ebooks, and so much more for all your foster parenting needs. This is a great book. Anytime a child's placed into your home from foster care, a different home, a new foster child story, beautifully illustrated. It's from the point of view of a 7-year-old girl being placed into foster care. And she has those questions. Why am I here? Who are these people? How long will I be here? But at the end of the story, she realizes this may be a different home, a different family, some new brothers and sisters, but I'm going to be okay. You can find this book and many best-selling books at the Foster Care Institute. I'm sure there's a book there right now that you need. Again, I want to thank MSPCC and the fantastic staff there for allowing me to share this webinar with you. I want to thank you for taking time out of your busy schedule to watch this. I know how busy you are as a foster parent. And I want to thank you finally for all that you do as a foster parent. Now, you may say that you're not a superhero or an angel, but I'm here to say that you are, because you're making unique sacrifices for this unique lifestyle. You're doing something that so few will do, and that is bringing a child in need, bringing a child in crisis into your own home and your own family. So for that, for the Foster Care Institute, I'm Dr. John DeGarmo. Thank you so much for all that you do. You are changing the world one child at